Thank you for joining us on Global Columbus. My name is Guadalupe Velasquez, and I'll be your host for this hour. For our first segment, we're going to be talking about the Cancer Awareness Conference that's for Latino families to be held on March 30th at the Lincoln Theater. And in honor of Women's History Month, I have three very strong, dynamic women who are very engaged in the community doing outreach, not only to women, but to families. And so my first guest is Maritza Motino. Thank you. And Maritza is the Director of Women Affairs for LULAC Columbus, which is the Council 39005. Our next guest is Adriana de la Peña, Program Coordinator for Ohio Health Research and Innovation Research Institute. Also, she is the Breast Cancer Awareness Program Coordinator. And then we have Sylvette, who is the Diversity Enhancement Program Manager for the James Cancer Hospital, correct?
That's correct.
They're very long titles, so I try to do my best to share exactly what you do. But with all of our shows, we like to begin to know our guests more before we get into the topic. So why don't we start with Maritza?
Well, my roots are from Honduras. I came to New York many, many years ago. About 10 years ago, I moved to Columbus, Ohio, with Victoria's Secret as a technical designer and intimate apparel. But as of today, I'm here representing LULAC Columbus and to talk about our conference in Latino that we're going to have at the Lincoln Theater. I'm sorry.
That's okay. And Maritza, so you said you went to New York, and what did you do in New York before coming to Columbus?
Well, I worked for several companies, I will say 3 or 4, which is Warner's, Playtex, and Ralph Lauren.
So it sounds like you were in the design field.
Intimate apparel.
I
actually went to school for casual wear. When I was 15 years old in my country, I graduated as a high couture stylist.
In Honduras?
In Honduras,
okay.
Yes. But when I came to New York, I continued my studies, and I worked for these 3 companies that I mentioned before. And like I said, I came to Columbus, Ohio with Victoria's Secret.
And I know that you have 3 or 4 wonderful, beautiful children.
I have 4 wonderful, beautiful children. 2 boys and 2 girls.
And the 3 that I know all have your genes and your talent, because they're all very creative. And I just love having them in the community because they're very community engaged as well.
Yes, so. And you need to know also the oldest one, because he's very talented too. Okay. He's a genius.
That doesn't surprise me. Adriana.
Hi. I was born in Mexico City, and I came to the United States in 1998. I came with my family, my husband and my children, because my husband had a position also in Victoria's Secret, and we are here since then.
This is so interesting, because you work for the Ohio State Institute, which also is connected with James, and then now it's the Wexner, right? The Wexner Medical Center, and here 2 people have arrived to Columbus for Victoria's Secret and one of the Wexner brands. Very interesting. I didn't realize our theme was going to be about the Wexners, but, again, something great about Columbus. Okay, Sylvette.
My name is Sylvette Lopez Ruth, and I moved to the United States in 1977. So I've been in the States for quite a while. I've been here in Columbus since then as well. I have moved away and have come back as of 2 years ago. I joined the Ohio State University when I came in back to Columbus. I moved away in 1998, and that's when the Spanish-speaking community started, coming and moving in. Mm-hmm. But as I, come back and I see, oh my gosh, there's a lot of Spanish-speaking people here now. So it was a great opportunity for me to join the James. And I worked for the Diversity Enhancement Program with the Comprehensive Cancer Center at the James with the Ohio State University. Again, I get tongue twist too with my title. And basically, I informed the community about the OSU and the Comprehensive Cancer Center. which is the James. I educate the community about cancer prevention, detection, and treatment, as well as trying to develop relationship, collaborating with other organizations, as you know, as Ohio Health and LULAC as well, and getting to know the community, and you know, sending the message of cancer awareness, which is one of the things we do at the James, and in my position in the Diversity Enhancement Program.
Well, thank you for the work that you do. Maritza, you have been the coordinator of the conference, so can you please tell us all about it? What can we expect?
Well, the idea is to reach out to the most remote of the Latino community, and as well to talk about 4 cancers. At this time, we chose to talk about breast cancer, cervical cancer, colorectal, and prostate cancer. And the reason we chose to talk about the 4 cancers in this conference is to bring the family together, because some of the times there is a conference for women's and men don't come along. So the idea was to bring men and women together, and if they have kids, that they can bring them along, because we're going to have children's activities as well.
So that's a great idea. You figured out a way to bring the whole family together.
The whole family.
And to learn about, to be more aware about cancer.
Yes.
Okay, and who are some of your community partners?
Our community partners are the Hispanic Coalition, the Hispanic Chamber of Columbus, Latin Ladies Organization, Centro Esperanza Latina, and I think I forgot one. I hope they forgive me.
We'll come back to you.
Thank you.
Adriana, you specifically are going to be doing awareness on breast cancer, right? Education about breast cancer awareness.
Yes, that's
Okay.
right.
So please share with us what you would like the viewing audience to know about the work that you do.
Well, I want to let them know that breast cancer is the first cancer in Latinas here in the United States. Even is the leading cause of death for Latinas. And we want to talk about the guidelines we have to detect this cancer in early stage when it's treatable, when they have a better opportunity for the cure. Actually, I work in Ohio Health Research and Innovation Institute, and what we do there is to educate the Latino community, and also we offer free mammograms for Latinas who qualify. We also have a hotline where Latinas can find all kind of information about breast health.
Do you have that number with you?
Yes, it's 563-663957.
One more time, please.
566-3957.
Okay, and so I just want to be clear. You said that breast cancer is the #1 killer of Latina women in the United States.
Yes, the first cause of death for cancer.
First cause of death for cancer.
In Latinas.
Okay,
Yes.
and how often do you do the mobile units, and where can you find out more about when you're going to have the mobile units out in the community?
Well, we don't have a scheduled plan ahead. We just find that they have a free day, they have the money, and then they call me and we organize everything.
Because you talked about having to qualify.
Yes.
What's that criteria?
Well, they have to be older than 40. They don't have to have insurance, and they have to be low income.
Okay. All right.
Yeah.
Thank you. Sylvette, please share with us what you'll be talking about at the conference.
I will be talking about prostate cancer, and I will be talking about colon cancer at the conference this coming March 30th.
And what would you like to share with the viewing audience about that?
I would like to share that as far as prostate cancer, it is estimated that that there are new cases every year, and I wasn't going to say I wasn't going to give the statistics, but new cases every year is 2,400 I'm sorry, 2,400. Oh my gosh, I'm
It's
sorry.
okay. So
Can
it's
you?
almost 3,000, can we say? Just
I'm going to say
almost
yes.
3,000
That's why I
of-
wasn't going to
That's
say
okay.
numbers. I'm sorry.
of what?
Of death.
Of deaths.
Of new cases.
Okay.
And then the death are 28,170.
Wow.
So that's a big number. So the new cases are 2 million. I'm sorry.
Okay.
470,000.
So
The
that's
number.
very
So
high.
that's very high.
And so in the work that you do,
And that's for United States. That's
Right.
not for the state of Ohio.
okay, so that's for the U.S. And in the work that you do, what is a common day like for you in terms of what you do with as it relates to outreach?
Well,
With
usually I get in groups. I do a lot of faith-based my programs, organizations, and I find a date where they can be together and find a topic that they would like to talk about, whether it's prostate cancer, colon cancer, cervical cancer, because I join, all the topics. But we pick a day, and we choose a topic, the topic that they want to talk about, and I teach them about, what the statistics are, one thing, but the things they need to do to prevent the cancer, whichever that might be.
Okay. And so being a woman, I know that I have received information. There's always information about after 40, you should have the mammograms. What do you recommend in terms of the
prostate cancer, and I'm gonna read this. For prostate cancer, there's 1 in 6 possibilities of develop prostate cancers in men. Okay. So that's very high. But they have 100% cure if they find it.
Detected early.
Detected early.
Is there an age that men should start?
50 years of age,
okay.
Unless they have it in the history, in the family history, and then they need to have it done at an earlier time. Okay. But the recommendation is 50 years of age.
Okay. And now let's go back to the conference and tell us a little bit more about what one can expect when they come to the conference and why it was important to put this conference together.
Well, the idea to put the conference together came when Adriana de la Peña contacted me, and she asked me if I would agree to coordinate with her a breast cancer conference. And I said yes. And then when I was alone, I started thinking about it, and I called her back, and I said, Adriana, what about if we talk about 4 cancers instead of 1? So this way we will have more audience, and we can get all the low-income Latino community to come all, in families together. So, and then, and we thought about making it free admission, that they don't have to be thinking about that they have to pay for the admission. And then that's when all came together, and I started knocking on doors and calling sponsors and calling all the organizations. And most important for me was to get all the organizations, all the Latino organizations together. Because if we want to make a better community, a better Latino community, the leaders in Latinos organization, we have to get together, work together. Absolutely. Because working together, we're going to make a better job.
And so that leads to my next question about what you want to accomplish. So that's one of the goals that you want to accomplish with the conference. What else would you like to accomplish at this conference?
Reach out to the Latino community and bring them the information. Most of it, the information, because I want to make a point that we will have a Sylvette and Sylvette Lopez and Adriana de la Peña talking about these 4 cancers. We will have also Mr. Benito Lucio. He works for Family Services, and he's going to have a segment in the conference. So we are bringing the information about this disease, but we are bringing also solutions, because he's going to be talking about medical insurance and all the resources that are out there for the Latino community.
Great. Thank you. Adriana, I noticed earlier we were talking about some statistics that were provided by Columbus Public Health. Would you like to share some of them with us?
Oh, sure. Well, I found here that the cancer is the main cause of death in Latinos here in Franklin County. I think that is very scary or surprising, and I think that the conference is an opportunity for all the Latinos to know more about these cancers and how to prevent them, if they are preventable, and what they have to do to detect them in early stages.
And that information can be found if you go to www.columbus.gov and then go to Columbus Public Health website, and they did a 4-page report on Latinos and the health of Latinos in Franklin County and in our community. I want to also invite our guests. This is a live show, so feel free to give us a call if you have any questions regarding cancer or any of the topics that we are discussing today. The number is 614-645-6557. Sylvette,
yes.
What else can you share with us about uterine cancer?
I'm glad that we're gonna have this conference, because I will have the opportunity to share not only with the community that they need to be aware of the things that are going on, and that they're easy to reach if they come to these community events. Also, that I have that we can partner with other organizations for the common goal of prevention on cancer, whether it's breast cancer, but colon cancer, cervical cancer, any of those cancer, because collaborating with each other is what we're trying to get to the people, that if you cannot find it here, there's other sources, bringing sources or resources to the community so they can find where can they go, where can they reach for help to get screened, to prevent, to get mammograms, to get, prostate cancer check, to get, there's different clinics out there that do the screening, and we will have the opportunity to meet other people and different vendors that will be there to help us out also. So when they call us, we can guide them to other services that they might need.
So if you come to the conference, you're going to find out about like un montón in Spanish. It's in English, a whole lot of resources, many different resources that are available to the family and to the community, right?
That's right.
Great.
We were also, I was talking to some, physicians that were asking, are we, can we go as well? And we say definitely, because that way they find out about what our community needs, our Latino, our Hispanic community or Latino Hispanic community, are what are the needs. That way those professionals know also where to to connect.
Absolutely, it's
to find the information
for service providers to know and to understand what some of the barriers or struggles may be for individuals. Right, because right now, today, we're talking about the Latino community, but it could also just be people who have a low income, right, or people who have a low literacy rate. So today we're talking about Latinos that need resources, but there are many people that need resources, and so you're bringing everyone together, right, to talk about how do you access information. That's right. Correct. And what would you recommend as best practices in terms of early detection and prevention for the cancers that the both of you outreach for?
For the breast cancer, the American Cancer Society recommends to have a mammogram after 40 years old every year. And also the ladies need to have a self-exam, a breast self-exam every month. And also the doctor needs to make a clinical examination. If the women are under 40, they need to have one every 3 years, and if they are older than 40, every year.
Wow.
Yes.
So every month that you should do a self breast
Yes.
exam. And should we like pick the same date, like the third Thursday of every month? Or,
Well-
what's the best way to remember
Well,
that?
if you are young, it's better if you wait until 7 or 10 days after your period. And if
Okay.
you are in the menopause, you need to choose one day, the first day every month.
Okay.
But if you are breastfeeding, they recommend that you have your examination after feeding your baby.
Okay. That's
And-
very helpful information.
Yes,
Thank you,
yeah.
Adriana.
You're welcome.
Sylvette,
Yes.
any best practices or?
Definitely screening. Don't wait till it's too late, because this is what the problem is, especially women. And and I'm going to be general. They're so busy with the families. They're so busy to make sure that they attend to the family, they attend to their husband, that we forget that we need to be taking care of us as well. So go get regular checkups. If you go get your checkups, and you will prevent. And there are services out there that will cover, like the mammogram mobiles. Ohio State also has a mammogram mobile, as well as Ohio Health. So there are ways. It's just a matter of taking care of yourself. You need to be taken care of, because if you're not healthy, you're not going to be able to take care of the rest of the family. So prevention, regular checkups, once a year when it's the recommended, and take the time, because that's important, not only for women but for men. Don't wait till it's too late, because if you wait till it's too late, then we cannot do anything about it. But most of these cancers are 100%,
And sometimes I think people don't go because they're afraid. They're afraid to know. And so it's really important that you're saying, go and do the early detection, because it's better to know, because as you said, in some cases,
Yes. Yeah,
right?
don't wait, because if you wait till the end, there's nothing that they can do about it. Then you'll be one of those statistics. You don't want to be one of the statistics. You want to prevent that, and you have a healthier life to come.
Okay, thank you. And so tell us more about the conference. Can you share the date and time and information once again for our viewing audience, and how they
Yes.
can reach you? You provided that information. It should be up on the screen.
Okay. The conference will be on March the 30th from 5:30 to 8 p.m. It's a free admission. You don't have to pay. Also, it's going to be at the Lincoln Theater, 769 East Long Street, Columbus, Ohio. And we will have rifles.
So you're going to have a raffle.
We're going to have a raffle. Yes, we're going to have many, many goodies, and music as well.
Part of the culture.
Part of the culture. So please come.
Right, and it's important to note that this particular conference is going to be in Spanish.
In Spanish,
Yeah.
yes.
So maybe
yes.
if you want to say something, go ahead and announce what you just did in English and Spanish for our viewing audience that speaks Spanish and that we want to reach out to make sure that they know about the conference. ¿Puedes decirlo en español, por favor?
Claro que sí. Que estamos invitando a la comunidad latina para que asista a la conferencia sobre el cáncer que va a ser en el Lincoln Theater.
¿Y qué más?
Y para que sepan que vamos a estar hablando de 4 cánceres diferentes, van a tener mucha información importante, y importantemente es que van a tener refrescos, aperitivos, y pueden traer los niños, traigan los niños, porque vamos a tener actividades para los niños también.
Perfect. Thank you so much. And I understand, again, you have some sponsors. So who are you named your partners earlier. Who are some of your sponsors?
Our sponsors are Tiendas La Michoacana, Jack and Benny's Restaurants, El Arepazo Latin Grill, Batista Le Flor, which is a gallery, it's a flower shop. We have Alexandra Ramos Insurance. We have Mary Kay, Molina Health, and D'Angelo Bakeries, and Amaya Productions.
All right, that's wonderful. And so we've talked about the Cancer Awareness Conference, and we've talked about the work that you do. I'm curious as to what drew you specifically to go into this work, for you to want to focus on women's issues and to volunteer for LULAC, and for you to do the work that you do, because it is very difficult. I know that Sylvette and I talked about when you do grassroots work, that it's not really just the education that you're providing. You really become a resource about everything, about education, about access to so much more than just health care. And so what drew you, what drives you to do the work that you're doing? Anybody can start.
Well, I love to help the community because I am a family doctor in my country. That means that I love to help the people.
So you're a family doctor?
I am a family doctor.
Licensed in Mexico?
Yes.
Correct?
Yes. Also, I am a breast cancer survivor, and
Okay.
I think I want to help the Latinas because I know how it is to have that illness here in this country when you don't speak English, when you don't know where to go, and you don't have the resources. And then I think it's very important to inform to my community all these issues.
Extremely important. Thank you
Yes.
for sharing.
I feel passionate about it because I know how hard it is to find resources. I have a disabled young man, my son, and I found myself looking for, thinking if they don't know the language, it's hard enough knowing the language to go from one place to the other, to the other, to the other. Mm-hmm. I can imagine what it is for someone that doesn't understand and that depends on an interpreter to try to go. So there's going to be space, you're not going to find the whole story. So I felt really passionate about trying to help the community because there are places that you can find, there are resources that you can find to, to help them out, mm-hmm. especially for something like cancer. There's, like you said, you become the resource person, but I don't mind because I want to let them know that there is this place out there, there is this other clinic out there that, that they can go, mm-hmm. So I feel very passionate about educating and doing the work for, for the James because, there is, space for all of us, right? To be able to share that, that information. Mm-hmm. But I definitely think it's because, it's hard for those who don't understand how to go about a healthcare system. Mm-hmm.
It's very difficult.
That
and
is
again,
difficult.
Like you said, even if you speak English and you were born here in the United States, it is just hard to resource information. Mm-hmm. As if you're not out and about or you didn't grow up with a tradition of doing, going to have screenings or doing the self-examinations. So sure it is. So you're very passionate about helping people and being a resource to people.
Absolutely, yes.
Thank you. And Maritza?
Same as my colleagues, my passion to help the Latino community. And it's not actually only Latino community, because for me, if I see someone in need, I want to be there to help. But at this time, I saw that there is a need of information in my community. And that is the reason that I got engaged with LULAC, and then now with all the Latino organizations.
Okay, and we have been using the name LULAC, but could you explain what LULAC is?
LULAC means Legion of Latin United American Citizens.
Great. And again, your title is the?
Director of Women Affairs.
Okay, but today you're talking about the conference.
The conference
is on March 30th.
On March 30th at the Lincoln Theater. Don't forget, March the 30th at the Lincoln Theater from 5:30 to 8 p.m. And it's free.
And it's in Spanish this time.
In Spanish. It's in Spanish for the Latino community. Great. But if you speak English and you understand Spanish, you're welcome.
All are welcome to attend. Again, for more information just about health tips and information regarding health, please go to the columbus.gov website. and go to Columbus Public Health. There you'll find a large amount of resources, an outstanding website that will give you information about anything related to health, but also you can access this Latino health report that was released recently. And so, any final thoughts as we begin to wrap up the show? Adriana?
Well, I just hope that we have a lot of people, because we want to let them know about these programs we have, about these cancers, how they can detect them early, and they need to be aware about this.
Okay.
I want to also, just like Adriana said, make sure that people, come and join us in this conference. But also, I want to, let also the healthcare providers, to attend, and that this is important information for the providers, as well.
So the conference is for families, so men, women, children, and healthcare providers.
Oh, absolutely.
And maybe even people in the community who look out for their neighbors. And so they might want to go to obtain information about how to provide information for their neighbors, just being a good citizen.
That's right. That's right.
Any final thoughts?
Yes, we hope you all come. This is a very important conference in Spanish. Bring your friends, bring your cousin, bring your mom, everybody.
And
I hope I have a second, because I want to thank Molina Healthcare for supporting us in this event.
Great.
And all our sponsors and organizations that came together to bring this information so important for the Latino community.
okay, so with that, we'll wrap up the show, and I'd like to thank our viewing audience for watching this segment of Global Columbus. We'll be back in a couple of minutes to talk about International Women's Day, and also talk about women in general, because the month of March is Women's History Month. We hope that you'll stay tuned, and we'll be back.